Welcome to Real Life Truth, where we embark on a journey through the intricacies of human sexuality and well-being. Recognizing the dynamics and impacts of sexual activity or its absence is pivotal for nurturing healthy relationships and personal development. In this exploration, we delve into 15 potential signs indicative of a woman's extended period of sexual inactivity. These signs encompass physical, emotional, and psychological dimensions, offering insight into the complex nature of human sexuality. By acknowledging and comprehending these signs, individuals can approach their sexual experiences with heightened awareness and seek assistance if required. Come join us as we delve deeper into this fundamental aspect of the human experience. Changes in self-image. Sexual experiences can influence how individuals perceive themselves sexually. Without recent sexual activity, some women may experience shifts in self-image, potentially leading to feelings of inadequacy or insecurity regarding their sexuality or attractiveness. Increased emotional sensitivity. Regular sexual activity can release hormones like oxytocin, which promotes feelings of bonding and relaxation. Without this hormonal release, some women may experience heightened emotional sensitivity or mood swings. Difficulty in achieving orgasm. Lack of recent sexual activity may lead to difficulties in reaching orgasm. This could be due to decreased genital sensitivity or changes in arousal patterns resulting from the absence of sexual stimulation. Increased risk of sexual pain disorders. Lack of sexual activity can increase the risk of developing sexual pain disorders such as vaginismus or dyspareunia. These conditions may arise due to decreased vaginal elasticity or pelvic floor muscle tension. Changes in body temperature regulation. Sexual activity can stimulate circulation and increase body temperature. Without it, some women may experience changes in body temperature regulation, potentially leading to increased sensitivity to cold or heat. Altered mood regulation. Sexual activity can contribute to mood regulation through the release of neurotransmitters like serotonin and dopamine. Without this regulation, some women may experience mood swings or difficulty managing emotions. Increased risk of urinary tract infections. Sexual activity can help flush out bacteria from the urinary tract. Without regular sexual activity, some women may be at an increased risk of urinary tract infections due to bacterial overgrowth. Changes in appetite or food cravings. Sexual activity can influence appetite and food cravings through hormonal changes. Without it, some women may notice alterations in their appetite or cravings for certain foods. Decreased bone density. Regular sexual activity can contribute to overall bone health through hormonal regulation. Without it, some women may experience decreased bone density over time, potentially increasing the risk of osteoporosis. Changes in hair and skin health. Sexual activity can promote circulation and hormonal balance, which may contribute to healthier hair and skin. Without it, some women may notice changes in hair texture or skin condition. Altered perception of time. Sexual activity can provide a sense of connection and engagement that may alter perception of time. Without it, some women may perceive time differently, potentially leading to feelings of boredom or restlessness. Increased risk of cardiovascular issues. Regular sexual activity can contribute to cardiovascular health through increased physical activity and stress reduction. Without it, some women may be at an increased risk of cardiovascular issues such as hypertension or heart disease. Changes in vocal tone or pitch. Sexual arousal can affect vocal tone and pitch due to changes in breathing patterns and muscle tension. Without recent sexual activity, some women may notice alterations in their vocal characteristics. The altered sense of smell or taste. Sexual activity can influence hormonal balance, which may affect sensory perceptions such as smell and taste. Without it, some women may experience changes in their sense of smell or taste sensitivity. Increased risk of depression or anxiety. Sexual activity can contribute to emotional well-being through the release of endorphins and stress reduction. Without it, some women may be at an increased risk of depression or anxiety disorders. Changes in muscle tone. Engaging in sexual activity can involve various muscle groups, contributing to overall muscle tone and strength. Without it, some women may notice changes in muscle tone or definition over time. Increased sensitivity to pain. Sexual activity can release endorphins, which act as natural pain relievers. Without it, some women may experience increased sensitivity to pain or discomfort. Altered immune function. Sexual activity can modulate immune function through various mechanisms, including stress reduction and hormone regulation. Without it, some women may experience alterations in immune response or increased susceptibility to infections. Changes in vision or eye health. Sexual activity can promote circulation and hormonal balance, which may contribute to eye health. Without it, some women may notice changes in vision or eye discomfort. Altered sense of balance or coordination. Engaging in sexual activity can involve coordination and balance, which may help maintain these abilities over time. Without it, some women may experience alterations in their sense of balance or coordination. Decreased libido. A reduction in the desire for sexual activity could suggest a period of sexual inactivity. This decline might stem from various factors such as stress, hormonal fluctuations, relationship dynamics, or even underlying health conditions. It's essential to recognize that libido can fluctuate naturally and may not solely reflect recent sexual history. Minimal vaginal lubrication. Insufficient natural lubrication during arousal is a common indicator of infrequent sexual activity. Vaginal lubrication serves to reduce friction and discomfort during intercourse, and its absence may signal a lack of recent sexual engagement. However, it's crucial to consider that factors like hormonal changes, medications, or hydration levels can also affect lubrication. Changes in vaginal elasticity. Regular sexual activity helps maintain the elasticity of vaginal tissues. Without this stimulation, these tissues may become less flexible over time. Reduced elasticity can result in discomfort or difficulty during intercourse, highlighting a potential absence of recent sexual encounters. Increased vaginal tightness. Conversely, some individuals may experience increased vaginal tightness due to a lack of recent sexual activity. This tightness could stem from reduced stretching of the vaginal muscles, potentially leading to discomfort or pain during penetration. It's essential to note that vaginal tightness can vary widely among individuals and may not always indicate sexual inactivity. Decreased confidence in sexual situations. Confidence in sexual situations often develops through experience and familiarity. Without recent sexual activity, individuals may feel less assured or comfortable engaging in intimate encounters. This lack of confidence can manifest as hesitation, anxiety, or avoidance of sexual situations, impacting overall sexual satisfaction and well-being. Changes in masturbation habits. Masturbation frequency or intensity may decline in parallel with a decrease in sexual activity. However, individual masturbation habits vary widely and can be influenced by factors beyond sexual encounters, such as stress, mood, or personal preferences. In conclusion, recognizing the signs of prolonged sexual inactivity in women is crucial for understanding the complexities of human sexuality and its impact on overall well-being. By acknowledging these signs, individuals can take proactive steps to address any concerns they may have and seek support if needed. Remember, sexual health is an integral part of holistic wellness, and open communication, self-awareness, and seeking professional guidance when necessary are essential components of maintaining a fulfilling and healthy sex life. Thank you for joining us on this exploration of sexual health and well-being.